So let's have a recap of how substance abuse is related to other problems that people might be dealing with. Because again, it's that comorbidity, it's that the hand in hand of substance abuse and other problems as a result. Let me answer one question that was asked, and it was about returning veterans with PTSD and why is there a higher level of substance abuse with them? And I think that's a very good question. And maybe as listening to what we've talked about before, you can piece this together. Substance abuse is often used in order to make one feel better. So we would call that self-medication. You're treating yourself with a substance. So let's look at PTSD. And let me remind you that the person doesn't have to be a veteran in order to have PTSD. That is common that veterans have this if they've been exposed to war or whatever kinds of dangerous, life-threatening situations, seeing other people killed and other horrific things. Nonetheless, any of us could develop PTSD at any time if we're involved in some kind of trauma. So as far as some kind of car wreck, um, or any kind of abuse, anything like that. Maybe it happens currently. Maybe it's childhood sexual abuse or physical abuse in the past, and we have it as a result today. So, um, PTSD, post-traumatic stress disorder, is an anxiety condition. Often people don't look at it as an anxiety condition, but it definitely is. So the person is more likely to have not only traumatic memories of what happened, but they're more likely to have exaggerated startle responses. So be very scared at loud sounds, be overwhelmed quite easily in that regards. More likely to have depression, more likely to have all these fear thoughts, nightmares. It's more in the extreme situations where the person actually has flashbacks, that they're reliving that traumatic incident. Because a lot of people think that a person just has flashbacks all of the time. Actually, that's more rare, but nonetheless, it definitely does happen. So often it comes out as nightmares and just simply intrusive thoughts of the trauma that happened, and it looks like all different types of anxiety and depression, just low mood, can't sleep. Um, the person might have their ups and downs. Maybe they don't want to deal with people, just become overwhelmed quite easily. So, I mean, that's often what a person with PTSD looks like. So if you think about it, one of the easiest things that a person can do is when they're dealing with all of this anxiety and depression and all of this is to drink too much or smoke a lot of pot or do whatever in some kind of pill. And in the short run, that makes it better. It lowers your levels of anxiety and everything and makes you feel more relaxed. In the long run, you end up with these addiction issues that it takes more and more of the same drug to feel better, and you have all these side effects of maybe health problems, relationship problems, problems at your work as a result of your use. So it doesn't work out in the long run. There are medications out there, and when someone's dealing with antidepressants, or let me say that again, when someone's dealing with PTSD, antidepressants is what we want to prescribe them, because that will help them out. That will just help to regulate that mood overall. There are some concerns about prescribing drugs outside of the antidepressant realm, like as far as any of the benzodiazepines being like Klonopin or Xanax or something like that. There are a percentage of people with PTSD who will be prescribed this. But nonetheless, there are research studies out there, especially through the VA, that says that that's not a good long-term route to go. And the antidepressants is really what the VA approves in these situations. So that is something to look at and to research further. So those are definitely some reasons that someone with PTSD might abuse some substances. Don't forget that the person might have already had a history of abusing substances before they developed PTSD or any other diagnosis. So we can't necessarily say that that diagnosis caused them to start abusing the substance. It may have, maybe not. So that definitely is something to look at. So let's get a little bit more practical here. So what do you do when someone has a substance abuse disorder, or at least that you think that they do? So I would say step one is to look at, okay, what problem does their substance abuse cause? And if it looks like it's causing a problem, you're worried about their health or there's family problems as a result, people are concerned, then get them in for an assessment. And of course, me being a therapist, I'm going to say, okay, well, get the person in for a mental health and a substance abuse assessment. Notice that I say both because we need to look at both sides. Maybe it's primarily depression or anxiety, and nonetheless, the substance abuse is going along with that, or maybe it is primarily substance abuse. So if you get a third party involved, an outside party, they're able to look at the situation and to figure out what's going on here. And remember that anyone that you go to for an assessment has dealt with a lot of people in this type of situation before. So they're able to see what are the severe cases, what are the more minor cases that can probably get worked out, and be no big deal. So they can give you an idea of what's going on here. So that's definitely something that I would recommend. So let's say that the person undergoes a substance abuse assessment and the clinician says, okay, yes, it does look like there's a problem here. Well, there's a lot of different ways to deal with this. So we'll say with in the most minor situations, you just bring it to light, and then the person says, okay, I'm going to find other ways to deal with this, and they just stop on their own. That does happen, and I don't want to be one of those therapists that says everybody needs help and nobody can do it on their own, because there are plenty of people who do it on their own. It does happen. So if you go one step up, let's say that they need a little bit more help. AA, NA, so Alcoholics Anonymous, Narcotics Anonymous, those are 12-step programs that are actually self-help. It's not professionally led. There is no fee. They have these in most any town, especially here in Lafayette. They have these meetings on a daily basis at all hours of the day and night. So it's a great program that can help people. And again, it's self-help. There is some structure to it. There's the 12 steps. You can get a sponsor. A sponsor is someone that leads you through the steps, and they hold you accountable and help you talk through your issues and all that kind of thing. So that would be the first step that you would look at. If you look at professional therapy, that would be a step above that. And when a person does professional therapy, often the therapist asks them, why don't you go to AA or NA as a supplement to the therapy? So that's really common. I've got a lot of clients that I ask them to go to meetings, and it helps them significantly. And then, just as we talked about before, it's not always substance abuse. I mean, it can be some kind of behavior. So here in town, I send some of my clients to Sex Addicts Anonymous if they have a sexual addiction. So that's something that I deal with fairly often as well. So in therapy, the more minor part would be like weekly individual therapy. You talk about the substance abuse, you talk about the stresses that go along with it, if there's any self-medication and that kind of thing. So that's something that I help my clients with. And That would be more of the on the lesser of the substance abuse scale. So doing it once a week, 45 minutes, that kind of thing. Maybe there'd be some family involvement, or couples therapy, whoever that might be. And sometimes people just they bring their neighbor or bring their friend. Any kind of support is a really good thing. So that would be one level. The next level up would be IOP, and that stands for Intensive Outpatient Therapy. And and what that is it's group therapy, and stereotypically it meets 3 times a week for roughly 2 hours each time. So it depends on the program. The traditional programs are 12 weeks. There's always a variation on that. If the person needs more than the 12 weeks, then they stay longer than that. If they're able to work through their issues before that, then sometimes it's less than 12. So depends on the program as how they run that. And there's an argument that if you do therapy in a group, then the group members hold each other accountable for their actions and try to get them to be more honest and all that kind of thing. So that would definitely be a next higher level of care. But the good news is that you're able to go home every night. You're not inpatient or anything like that. So 3 times a week for a couple of hours at each time. You might supplement that with individual therapy. So that might be something that happens. So that way you have the group component as well as the individual component. So you're able to get all of your issues addressed, especially if you're dealing with some anxiety and depression at the same time. So that's what's commonly done. And then, of course, 12-step meetings are quite common. The next step up from that is, let's say that the person just really, the IOP isn't doing it, and all this other therapy isn't doing it for them. They're still using, there's still problems. So day treatment or partial hospitalization. I don't know if I'm using that term correctly. It's not used very much, and that's why it's not coming to me right off. But it's think of it as a business day of 8 hours per day, Monday through Friday. You go to the hospital for this partial hospitalization. And it's even more intensive with the individual, with the groups. You're in a controlled environment during business hours. So if that's not effective, then the whole granddaddy of them all is the inpatient hospitalization. And stereotypically, that's your 28-day program. Sometimes it's several months. It just depends on what the need is. And with that, there is definitely a medical component involved, as far as you're doing all of the meetings and all of the counseling and all of that kind of stuff. And detox would be part of that if that's needed. Definitely having psychiatrists on hand to help with any kind of the psychiatric issues where drugs would be needed and that kind of thing. And I should say that with everything that I've discussed, if a person needs medication, then that needs to be implemented as well. So you don't just simply wait till you get to the highest level of care in that situation. Once the person gets better and they're released from whatever type of program that I just described, then you want to do some individual therapy. Typically it's on a weekly basis, and that's often called aftercare. And what it is just making sure that whatever you learned, let's say in your inpatient treatment, that you're continuing to use that on the outpatient side. So the rate of relapse is really quite high when someone is released from a residential or hospital facility. Because if you think about it, you are completely, in this bubble, and then you have no temptation of liquor stores or the drug dealers or the using friends or anything like that. So you need to keep up your work, the hard work that you've done once you've been released. So that's why going to some kind of outpatient therapy. So it might be the individual therapy, or it might even be going to the IOP that I talked about earlier. So as far as 3 times a week, it's stepping you down from there. And you need to have some family involvement. You need to have everyone pulling for you. So that's the general idea of what is done for someone that has is actually working through these substance abuse issues. And many times people will go to whatever 12-step program that works for them. So AA, NA, there's a lot of them out there, a lot of other variations of those. And you keep it up with weekly meetings or several times a week meetings, whatever you need. And sometimes people go through this for years in order to keep them on track. And if you look at the tradition of the 12-step programs, it's a lifelong program, and you never complete it. And nonetheless, it keeps you on track, and it helps you to do well. So that's the overview of what substance abuse treatment is. There's definitely a lot to it, but those are definitely the modes. So it just depends on the level of care that the person needs, and then they pick the appropriate treatment. The professional can help to guide them to where they need to be. And if what you're doing isn't working, then you need to figure out something else. So you might have to try a few different modes until you find the right thing.